Hello everybody, welcome back to The London Nurse. I am Ben, and today I would really like to talk to you about stupid little mistakes that I've made as a student, but also kind of over the 8 years that I've worked with students now. I have a pretty extensive bank of experiences that I can offer to you so you don't feel alone when you make a mistake in practice. Before I start, I'd like to say a huge thank you to everybody that has subscribed so far. It really helps me out and it really spurs me on to continue. I want to get this out there right now because you may not last until the end of the video, but I really want to tell you, or I guess reassure you, that mistakes are okay. You are a student nurse. Every mistake is a learning opportunity. So be ready to make your mistakes, but own up to them, reflect on them, and learn from them. That is all that anybody asks of you. So the most common mistake is students not owning up when they make a mistake. Now, obviously, this is something that goes far, far beyond just being a student in practice. That might kind of relate to your upbringing. Perhaps you've experienced in the past where you have made a mistake, you've owned up and you've been penalised, or you've had some kind of serious repercussions because of it. But in clinical practice, as a student nurse, if you make a mistake, you have got to own up to it. Now, it's pretty scary, I understand, but take it from me, it is much better as soon as you recognise that you've made a mistake, or even before you go and make a mistake, own up. Own up before if you don't know what you're doing or you've never experienced that situation or clinical skill or clinical duty before. Tell somebody, and it's okay to say that you've not experienced that before. Or as soon as you know that you've made a mistake, so whether you have done it, it doesn't look right, and then you realise, whatever it is, as soon as you realise, go and tell somebody. Tell the nearest person to you if it isn't the nurse that you're working with, but you have got to highlight that to one of the registered staff. Depending on the mistake, some of the silly scenarios that I certainly have done as a student, leaving the cap off the bottom of urinary catheter bags, so there's urine all over the floor, starting a nasogastric feed off and leaving the clamp on and realising suddenly that there's pressure building up and the feed stops going. Obviously, you have to then make sure that as you turn it on, all of that feed isn't going to go rushing down the tube into the patient's stomach or jejunum, wherever the tube is. Go and get help. So you recognise the situation before trying to manage the situation to put it right. Go and tell somebody. Get them there with you. They can then not only see that you've recognised the problem, but you're also willing to try and resolve the problem and manage that situation accordingly. The best thing that can come of that is that it's a learning opportunity. Like I said, every mistake is a learning opportunity if you decide to take it. Another common situation that I encounter on a semi-regular basis at work in the hospital is where students don't get on with their assessors or supervisors and they make an issue out of it. Hear me out, because I understand that some of you might be switching off right now because it's quite a delicate subject to talk about. Not every nurse will be a good teacher. We know that. We're working on that. The thing for us though is that if you find yourself working with somebody that isn't necessarily the nicest person or the most forthcoming with answers to questions, doesn't mean that they've got an issue with you, that they don't like you, or that you've done something wrong. Don't reflect all of that on you and just in your mind just think, I wonder how they are today. What's going on in their world? Maybe I can make their day better by taking the patient off them, or whatever you feel comfortable doing to try to resolve that relationship issue. The worst thing that you can do as a student in that situation is to close down. And by close down, I mean mentally and physically. So what tends to happen when you have a relationship breakdown in clinical practice with the people that you're working with is that you, rightly so, switch off. You don't want to be there. You don't want to be in the presence of that person. You don't want to do anything to help them. You don't like it when they ask you to do something because you think they're being bossy. And you start to shut down. You start to think, why am I here? What am I doing? I didn't come to work to be spoken to like this. If it gets serious and you do know that there is an issue, seek support. Go and speak to somebody senior on the ward. It could be the nurse in charge, it could be the ward manager, the educator, or somebody external. Speak to your university, chat to your personal tutors. They will be able to support you in the moment while that is going on. But the best thing that you can do as a student finding yourself in that particularly tricky situation is to focus on those jobs that you can do with minimal supervision, i.e. carrying out your patient assessments, tidying up rooms, speaking to families, speaking to patients themselves, so that you can continue to do your job, continue to learn, stay out of the person's way as much as feasible. You still have to obviously touch base with them, but make sure that you are not becoming the problem. Rise above it. Seek the support if you need it to either address the concerns directly with that person if it's that bad, or if you perhaps think you're just taking things a little personally, listen to that gut instinct and try to do things to remove situations where you might be forcing yourself to do that. Relationship issues are huge in work. When it comes to learning, you have to feel safe and secure with the people that you're working with. It also works the other way though, that nurses need to feel comfortable and trust the student that they're working with, that they're going to do everything to a high enough standard because you're practicing under that nurse's pin, under their registration. So always remember that point, that actually some nurses don't feel comfortable to question, assess, supervise students working under their pin, so they actually decide not to do it at all. It's a huge topic. I'm going to stop there, but actually I think I might do a video on that in the future because I have so many tips and hints on how to overcome situations like that. Now, another thing that kind of feeds from the theme that we've just talked about regarding kind of relationships, is when students get defensive when they receive feedback. And it's often around times where you receive constructive feedback. Now, I've said in my previous video that feedback is always going to be personal. It's about your ability, your skill, your personal behaviours, professional behaviours. It will always be a personal thing. I challenge you, the next time you receive constructive feedback, and by that I mean you maybe could develop in some way around a certain skill that you're practicing or in a nursing duty, listen to the words and not the tone in which it's being delivered by. Some people do not have the knack to be able to deliver constructive feedback in a way that is just neutral. As a student receiving feedback, know that it's not that you're really bad and that you're rubbish at everything. It's purely just that you're learning, and people need to give you that advice to help you become a stronger, more efficient and effective, knowledgeable practitioner. If you listen to that feedback, you will only develop further. You will also inevitably, as a byproduct of that process, develop resilience around dealing with people, working with people that just have a very unhelpful tone to the way that they talk. So take that challenge on. The next time you are in a position of receiving some kind of constructive feedback, pause. Just listen to what's being said. Be honest in that process where you're talking through the situation that your assessor or supervisor or nurse that you're working with is trying to help you move on and develop in that area. When you're talking back to them, drop any of the attitude, which I will come on to in my next point because it's a knee-jerk reaction. So just pause, listen to the words that are being said to you, drop everything else, and just absorb the areas in which you could do better. Let's discuss back chat. And I say back chat because often that's what it is. So again, from my experience of working with students in clinical practice, there are times where students do give back chat, and there are valid reasons for it, and I fully understand from being in similar situations as a student where you just want your say and the person that you're working with is not having it. Now, there is a very big difference between giving cheek or back chat to somebody and questioning further about a scenario, a situation, or even a bit of feedback that you've received to learn more about what the person is talking about. There are definite ways in which you can and cannot talk to one another in the professional setting. It's worth kind of building up some phrases so you can basically just have them in your back pocket ready to roll out when you feel like you want to explore something further and you want to say something like, how do you mean? Like what? Give me an example. Swap those things for phrases such as, that's really interesting, I hadn't noticed that. Could you tell me some more about what I did there? Or if you do know that you're receiving feedback about your resting, not interested face, also known by other phraseology. You know what I mean. If you're one of those people that just naturally looks disinterested, you will probably going to get this feedback quite a lot. And it's because you do need to work on it, but also it's incredibly personal, especially if you get it all the time. So if somebody says, "Are you okay? You don't look like you want to be here today," instead of going, "Yeah, I'm fine," you can say, "Yeah, I'm really aware that when I'm just kind of in the zone or thinking about something, my face says to people that I'm not interested, and I want to reassure you that isn't the case, but I am learning on how to hold my face when I am not interacting with anybody." It's so important that you develop insight as a student, because you are going to need that insight more and more the more senior you get as a student, and obviously the more senior you get in nursing. Okay guys, I hope that has given you some food for thought. I appreciate that some of those points might feel a little bit difficult to kind of absorb, but if you do have any questions about those, leave me a comment underneath, let me know what you thought about this video, and if you've got any suggestions for future videos, then again, let me know in the comments box below. Subscribe if you haven't. If you like the video, hit that thumbs up for me. It's really helping me to gauge the audience and what you guys want. So until next time, own up to your mistakes, reflect on them, learn from it, and move on. Bye.